And we are on your side with warnings for your personal safety this morning. Many people take pain-killing medicine thanks to a doctor's prescription. Many people need it for back problems and different things.
Well, some of those medicines can be dangerous, and you could wind up with an addiction, just like celebrities like Michael Jackson. He admitted to having one a few years ago. So how can you protect yourself? Well, joining us live this morning from Chicago to talk about this is the president and CEO of the National Safety Council, Deborah Hirschman. Deborah, good morning. Thank you so much for joining us.
Good morning.
Let me first ask you, this is a big problem across our country. What advice would you give people who need these pain meds but do not want to become addicted?
You know, I'd say the first thing for people to understand is to know what they're taking. Many people don't understand that prescription opioids actually go by the brand names oxycodone, Percocet, Vicodin, and so it's knowing what you're taking. These can be very addictive medications, and so you want to make sure that you understand that. The second thing is these are also things that are sought out by other people, so you want to lock them up and secure them in your medicine cabinet. 70% of people get their drugs from friends or family. And the third thing that I would say is making sure that you understand how to dispose of them properly.
Now, when it comes to painkillers, are there things other than Vicodin and Percocet that people can take?
Absolutely. A lot of studies have shown that those treatments, those prescription opioids, actually aren't even the best for dealing with pain. Combinations of ibuprofen and Tylenol can be very effective. So it's really important to talk to your doctor, particularly if you have risk factors for addiction, and that can include anything like alcoholism in your family or even smoking. We know that prescription painkillers are a gateway drug to heroin. 4 out of 5 heroin users started with prescription painkillers. They're highly addictive.
But sometimes people really need them for different problems, back injuries or different things, and they really need them just to function on a daily basis. What advice would you give them if they do have to take this medicine, but they don't want to become addicted? Do they just try to wean off slowly? What should they do?
Well, the really important thing to understand is people might need these, but they generally need them for a very short duration of time. If it becomes a chronic issue where they're needing them on a daily basis, that really is when the addiction can start. People start taking more of the medications to get the same amount of pain relief, and it's a really destructive cycle. And so when you have an acute injury, a back injury or something like that, make sure when you talk to your doctor that you take it for the shortest duration possible and that you discuss alternatives, because there are alternatives to these opioid painkillers.
And it can be scary, okay?
Well, Deborah Hirschman, the CEO of the National Safety Council, thank you so much for joining us.
Thank you.
A lot of people struggle with that, so hopefully we can help them out a little bit.